antidepressants and anti-everything. And if you don't think EFAs and icosanoids affect the brain, by the way, they do. And there's a role that they play in depression. And antidepressants, some of them anyway, will work this way by affecting icosanoids. Pretty much, I don't say all drugs, but probably the very large majority of them work by blocking icosanoids. In fact, there's two major ways that inflammation and immunity can be affected by drugs. One is by steroids, prednisone. Whenever you hear "own" at the end of a word, prednisone, beta-methasone, dexamethasone, you're talking about a steroid. O-N-E, own, means steroid in the world of chemistry talk. So one of the classes, major classes of inflammatory medicine or of anti-inflammatory medicine is steroids, ONs. The other ones are non-steroids. That's what they call them, non-steroidal. If you ever heard the term NSAID, N-S-A-I-D, that stands for non-steroidal anti-inflammatory drug. Why are they non-steroidal? Because they work by icosanoids, which are activated EFAs. Aspirin works by affecting your activated EFAs. Naproxen works by affecting your activated EFAs. Tylenol works by affecting your activated EFAs. These are all essential fatty acid drugs, or at least their mechanism involves essential fatty acid drugs. Asthma drugs, as well as other drugs that are used for autoimmune disease, many of them work by blocking icosanoids. They're non-steroidal, meaning they don't work like a steroid, they work like an icosanoid. Aspirin works with prostaglandins. Vioxx and Celebrex, perhaps you've heard of those. That works with another type of icosanoid, the thromboxanes. And asthma drugs, like Singulair, that one works by affecting leukotrienes. It's actually called a leukotriene receptor antagonist, LRA. It blocks essential fatty acids. Leukotrienes are a version of essential fatty acids, active essential fatty acids. I hope you guys are getting that you want to get on your EFAs, especially if you're dealing with a disease, a degenerative disease, or any kind of inflammation. Icosanoids are our inflammation hormones. They are anti-inflammation hormones. You don't have inflammation, anti-inflammation, unless you've got some kind of icosanoid action, and that's why anti-inflammatory drugs utilize icosanoids. It's also why anti-inflammatory drugs, especially aspirin, may have horrible side effects. One of the leading causes of drug overdoses, of deaths due to drug overdose, is aspirin. And also Tylenol is a problem too. That's because you're throwing your icosanoids out of balance. You can't just mess around with your icosanoids pharmacologically. Yes, if you have pain or something, I'm not anti-drugs in terms of pain, and these things are tremendous effects on modulating pain because of their effects on inflammation, but not long-term. Long-term use of aspirin, long-term use of naproxen, that's where we run into a problem. Perhaps the very reason why we need the aspirin in the first place has to do with out of balance icosanoids. If you're on aspirin every day, and that's for blood clotting as well as for arthritis or any for its anti-inflammatory effects, or any anti-inflammatory drug every day for the rest of your life, you may want to think about working with your icosanoids, i.e. your essential fatty acids. Okay, I'm Pharmacist Ben. 844-236-6010 is our number. We're coming back with you and your phone calls and more good health information on the bright side right after this. Okay, we are back on the bright side from the journal Bipolar. I think that's the name of this journal here. Where the heck is it? From the journal Bipolar Disorders, Pennsylvania State University. Research: lower availability of omega-3 fatty acids associated with bipolar disorder. People with bipolar disorder have lower levels of omega-3 fats that cross the blood-brain barrier. What does that mean? Well, it means you have higher levels relatively, because it's all in proportion. They're in proportion with each other. You have higher levels of omega-6s. Omega-6 fats are pro-inflammatory. Does that mean that you want to avoid omega-6s? No, it doesn't mean that at all. It means you want to make sure you have enough omega-3s in balance with your omega-6s. That's where the whole idea of balance comes from. The problem is, as we've said so many times, and you probably heard so many times, we get way more omega-6 containing oils in our culture than we do omega-3s. That's not to say we get the omega-6s themselves, but we get way more of the oils that contain the omega-6s. Whether we get, how much we get of either omega-6 or omega-3s is really kind of up for debate. Nobody knows exactly, but if you want to pick one to supplement with, it would be the omega-3s because of the idea that we're getting all the oils with omega-6s. But you're probably best off doing both, 2-to-1, 3-to-1 ratio, omega-6s to omega-3s, something like that. Nobody knows for sure. If you're really positive that you're getting lots of oils with omega-6s in them and you're not cooking with them, then you may want to get a little less omega-6s. Ultimately, EFAs are the way to go. They're balanced for you. And go by your effects. Go by your inflammatory effects. Go by your fat cravings. In other words, you should have less inflammatory symptoms, and that includes depression and bipolar disorder. And you should have less blood clotting. You should have less inflammatory pain. And you should have less cravings for fats, too. Once you get enough of your EFAs, you're going to find you crave fats less as well. Tomorrow we'll talk about a very important omega-6, and I'll tell you about the two most important control points for controlling your eicosanoids. We have control over the kinds of and the amounts of eicosanoids that our bodies will be secreting based on two major things that we do on a daily basis. We'll talk about that tomorrow, and then we'll talk about a really cool omega-6 omega-6 EFA derivative that's got some wonderful eicosanoid effects on the skin. And if you have any skin diseases, eczema, psoriasis in particular, you have, by definition, an eicosanoid problem, which means, remember, eicosanoids equal EFAs. You have an EFA issue, either intake or absorption, and we'll be talking about that tomorrow and in the coming days on the bright side. Okay, time to hit our phones. 844-236-6010 is our number, and we do have lines open for you. Let's go to Texas and welcome Fidel to the bright side. What's up, Fidel?
Yes, good morning, Ben. Thank you for taking my call.
Sure.
I'm 28 years old.
Okay.
I'm starting to get noticeable fine lines on my face.
Oh, no.
And I wanted to see what skincare products or product from your skin line do you recommend to address this issue?
Okay. Great question. Thank you for asking. So now let me ask you a couple questions, okay? What's your body type? Are you lean, built lean and mean kind of thing, or are you rounder? Or tell me a little bit about your body type, height to weight, that kind of thing.
I'm about 6'3", 265 pounds.
Okay. So the reason I ask is because 28 is a little bit young to start to notice those fine lines, although it's not unusual, unfortunately. And that typically means that you've got a body type that is what we say androgenic as opposed to estrogenic. There's two major body types, two classes, if you will. Of course, there's zillions of body types, but there's two major classes. Androgenic, meaning you produce lots of male hormones, or relative, not lots, but relative to female hormones, you're more male hormone producer, and vice versa. Estrogenic body type has nothing to do with being a man or a woman. For anybody listening, has nothing to do with your sexuality or gender or any of that stuff. It's just some of us are predominant on one side, some of us are predominant on the other, and it usually is guys who are and women who are more androgenic or who are relatively higher androgen producers who are going to get those crow's feet. Now 6'3", you said 6'3", 280, or what did you say now? 6'3", 260?
Yeah, 6'3", 265.
Okay, did you gain weight as you got older kind of thing, or were you always a big guy?
I started gaining a little bit weight.
Okay. So all that's telling me that your hormones are starting to get thrown off, and it's not unusual, as I say, at the age of 28. That's really when it begins, although that is unfortunately kind of early. So you're going to want to do a couple things. First of all, you're going to want to focus on the fats, which we just talked about, and that means internally. Get yourself on the ultimate EFAs and anything you could do to improve fat absorption. However, from a topical perspective, internally is the key, no doubt about that. But from a topical perspective, there's lots you could do. Probably if you want to pick one product, I would tell you is my Truth Serum. If you want to pick two, do the Truth Serum and the retinol gel. Both retinol and vitamin C are the key players in not just preventing wrinkles, but also in slowing down their progression and even reversing them. And unfortunately, the only way you're going to get the the retinol is in the retinol 5% gel. Now, you get away with just the retinol 5% gel because that has some vitamin C in it. It has quite a bit of vitamin C in it, but you're not going to be able to use it every day, and you may want something in the middle. You may want to go more than 3 times a week with a treatment product, and that's why I say use the Truth Serum first and then the retinol gel second. Those would be the two that I'd recommend right off the bat. But don't forget the internal side. That's really the most important thing, is the EFAs and the icosanoids. Did I answer your question there, bro?
Yes, sir. Thank you so much. Thank
Okay,
you,
good
Ben.
deal, man. Have a beautiful day. Thanks for calling. Okay, yeah, so we got 4 products. We've got the Truth Retinol Gel, got the Truth Balm, got the Truth Serum, got the Omega-6 Healing Cream. If you want one product, pick your Truth Serum. If you want a second product, that's when you're going to go with the Retinol Gel. And then a third product, the Truth Balm. And then the fourth product is the Omega-6 Healing Cream, which is a multifunctional product and really works well with the Retinol Gel, hand in hand. Okay, 844-236-6010 is our number. Got a couple lines open. Let's go to On in California. What's up, On? What's going on? What's going on?
Hi, I had a stroke
Yes?
2 months ago, and I was wondering what I could do to...
Good question. Good question. Yeah, strokes. What part of your brain was affected on?
Ischemic,
Say again?
ischemic stroke. It was like...
An ischemic stroke. Yes, an ischemic stroke. That means part of your brain didn't get chema. Chema means nourishment or oxygen. So part of it dies. It's a terrible, terrible thing. Strokes, worse than death. It can be anyway.
Lipitor, but I didn't take it.
Is that the only thing they put you on?
No, some...
Blood thinners?
lorazepam,
Okay. What else?
aspirin, which you just talked about.
That's the blood thinner.
Losartan.
Losartan. Okay, got it.
And
Okay, they're basically slowing you down. Are you feeling like you're slowed down there, ma'am?
slow down.
Are you feeling slowed down, sluggish, that kind of thing? Because that's what's happening to you. All the drugs they're putting you on. If they just gave you one drug, it would zap your vitality enough that you'd feel like crap. But they're putting you on multiple ones. And the fact that you're even able to pick up the phone and call me is a testimony to the power of the life force. You are being majorly drugged, my dear. Majorly. Now, whether you need it or not, that's debatable. I don't know your condition, and I'm not going to go into that. Once our bodies begin to break down, sometimes you need emergency measures, and the idea is by slowing, by slowing the body down, you reduce the load on the body. My take on it is you want to strengthen the body, not shut it down. And there's many ways to do it. Hang on, let me just say this one last thing here. It's not like we're going to eliminate your stroke, but we're going to make you feel a lot better by giving you some, once you start getting on some good nutritional supplements. So hang tight. We'll finish up when we come back from our break. Don't go away, On. Okay, I'm Pharmacist Ben, and if you're out there listening and you know somebody who's had a stroke, you want to listen up. We're not going to get rid of the stroke, but we're going to make you feel a lot better. All right, I'm Pharmacist Ben. You're listening to The Bright Side. We'll be back after this. Okay, we are back on The Bright Side. I'm Pharmacist Ben. Thank you for joining us. 844-236-6010 is our number. We're talking to On in California. On, here's the deal. On had a stroke.
I'm also taking
Lodipine.
Lodipine.
Yeah. All of that is shutting your body down. That's basically what it is. Antiarrhythmics and this is the logic. Beta blockers, antiarrhythmics, anti-anxiety. I mean, everything's just anti, and it works by suppressing everything in your body. You got to be constipated. You got to be tired. You just got to feel like crap. And this is the medical model. Now, you probably think there's nothing else you could do, but there's a lot you could do. When it comes to having a stroke, part of your brain died or is gone. So, you're not getting it back. But that doesn't mean you can't start to feel better. So we all need to supplement, but if you have a stroke, you need to supplement more. We all need to be watching our foods, but if you had a stroke, you need to be watching your foods more. Number one, first and foremost, not foods, not supplementing. Start to practice slow, deep breathing. Ischemia is actually a sign that that your blood wasn't oxygenated, and it probably, if you haven't started breathing again, it's not getting any better. The drugs will only slow down breathing, slow down ventilation, make it even worse. There's no way drugs can't zap your vitality and make conditions worse. I don't know how many ways I could say this. As a pharmacist, I'm telling you, there's no way pharmacology cannot make things worse. It has to make things worse. Now, you're not even going to feel better. So your test scores will be better. That's what will be better. Anyway, slow, deep breathing. You've got to be doing it all the time. I usually tell people in the morning and night, you got to be doing it whenever you can think about it. Slow, deep oxygenation. You'll feel better right away. Within 2 or 3 minutes, you're going to start to notice you feel better. It'll improve blood supply. It'll improve nourishment to cells. You're going to feel better. Okay, it's 15 seconds. Go shoot for 15 seconds in, 15 seconds out. When you first start doing it, you'll probably be able to do 5 seconds in, 5 seconds out. But the point is slowly in through the nose, all the way to your toes, or at least to the bottom of your belly. There's a little catch. There's a little barrier right at our chest. You know what I'm saying? Right when you're deep breathing, there's a little